of the bullet-shaped 7404 burr to achieve a very smooth, hollow ground margin, which allows good definition and bulk of gold at the margins. The most obvious use of this concept is in placing a counterbevel on the lingual cusp, or functioning cusp of the maxillary teeth, and the buccal and lingual cusps of mandibular teeth, ensuing of the cusps as in onlays. This casting demonstrates the smoothness of the preparation achieved with this technique, and this picture shows the practical use of this principle, showing the bulk of gold in the wear area and the flowing outline of the finished case. Since we have discovered this procedure, many applications of its use have evolved. This is a typical onlay on a lower molar. As you can see, we use the 7404 burr to place the bevel on the buccal and the counter bevel on the lingual. It gives that thickness of gold in the wear area as the patient functions. As we've mentioned before, this is an add-on to the original Class II inlay preparation. We find sometimes that the lingual cusp is too weakened. This shows a practical case where the Buccal Bale was placed to take the stress off that weakened wall on the lingual. As we place the 7404 burr on the buccal wall, there are no line angles, no point angles, but little depth right into the wall, so it gives very good definition. And this can be blended a little with the buccal wall to give a very flowing outline. Now you can see this buccal extension that was cut with a 7404 burr that makes such a beautiful outline. The stress on the lingual wall is distributed to the strong buccal wall. We should notice the length of the bales and that it does not taper too much to the lingual. Also, it should be of reasonable depth so the bales will not bend or distort. It's another variation to the onlay. Sometimes a marginal ridge is too thin, as on this molar, and it needs to be included in the cavity. The same 7404 burr expediently crosses onto the distal without any distal box or hand instrumenting. Sometimes when we place an MO in an upper molar, we like to preserve the transverse ridge. In doing this, we use a 7404 burr with no hand instrumenting at all, just down the distal pit and down the lingual groove. It's a very simple procedure and produces a very nice cavity preparation. It's only back and forth with the burr. Now you can see we have a rounded pulpal wall and rounded lingual wall, so there's a minimum amount of damage and weakening of the tooth. It is not weakened as it would be if we put a flat pulpal wall on it. Also, it creates a nice flowing outline just with the shape of the burr. It is something that just fits for this particular type of lesion to produce a rather ideal cavity. This is an example of the finished casting in the mouth. This casting is special and fun to do. It is indeed a 2-minute inlay preparation, and it demonstrates the versatility of this particular burr.